boa tarde a todos. Estamos chegando perto do encerramento do Conahp. E essa plenária, ela acho que coroa, né, um dos aspectos de sempre, já virou uma tradição do Conahp, que é a inovação. Então, é um prazer ter o GERG aqui conosco para falar de algumas coisas que já fazem parte, né, do nosso cotidiano. E a gente para pensar quem foi que inventou isso, né? Então, eu botar uma câmera de celular e ele traduzir automaticamente. Então, foi uma pessoa, né? Uma pessoa que lidera certamente um time brilhante, que desenvolveu isso. É um grande privilégio, um grande prazer, né? Descobrir que tem uma pessoa, né, que ainda inventa essas coisas, né? Não é uma máquina que inventa essas coisas. Então, é um grande prazer poder ter você aqui com a gente, dividindo um pouco aí da mágica, né, que vocês produzem aí no Google, o que vocês podem trazer, né, para a área de saúde como contribuição. E eu passo a bola para você e, de novo, um privilégio ter você aqui com a gente.
Thank you so much. It's an honor to be here to be speaking to you all today. I wish that I were there in person, in country, but it's really a pleasure to be able to share some of the insights that we have from companies like Google in how artificial intelligence as a piece of technology can be used to improve healthcare and health outcomes. So I'm going to start by talking a little bit about artificial intelligence generally so that you understand how the technology works, and to demystify it, to explain how the magic happens. Now, we're all very familiar with the ways in which artificial intelligence technologies are in our hands already today. Just a few years ago, it wasn't possible for machines to interpret photographic images, and now we all have the ability to search for any photo that we've taken just using our phone. Similarly, we now have machines that are able to synthesize and understand language, whether that's for the purposes of translation or for the purposes of suggesting replies. And for many of us, it feels like we've crossed some kind of threshold in artificial intelligence, and really making tools that are useful to people, both consumers and hopefully professionals as well. I'm going to explain a little bit about why this is happening now and what are the techniques that we use at places like Google in order to build these solutions, so that it might inform how we move forward in healthcare. So the big thing that has changed is that for many complex but repetitive tasks, it is now easier to program a computer to learn to do that task than it is to explain exactly how to do it. And that may seem surprising, but that's actually the fundamental insight of artificial intelligence today, is that we can build machines that learn from data, that learn from experience. Let me show you some of the things that Google uses technologies like this for doing. It is not a general kind of intelligence. It's often called a narrow artificial intelligence because it always has a very singular input and a very singular output. So one of the common things that we do, for example, is to be able to recognize objects in images, or to be able to recognize and transcribe human speech, or to translate from one human language into another. And these things are all systems that have been learned through artificial intelligence to perform these tasks. And that is really the core insight that we have. One of the things that a question that I often get is, what is it that artificial intelligence is so strong at doing? And many people imagine that artificial intelligence is best at prediction. I don't think this is actually accurate. I think the most precise thing to say would be to say that artificial intelligence systems are experts at recognition. at intuitively recognizing a category or a condition. So how is it that companies like Google get systems like this to work? And the core insight that I think it's worth everyone understanding is that machines today, they learn by imitating examples. It is an imitation game. And so, for example, if we want to build a machine learning system that recognizes photos of cats as compared to photos of dogs, photographs of dogs, and allowing the machine learning system to imitate that classification. Let me go into a little bit of detail about how that happens exactly. So here I have an example. Let's imagine that the input to the system is a photograph. There's a part of the computer system that we sometimes call the model or the machine. That is the piece of program that actually takes the input image and tries to guess the object that is presented. But the way that the system works is that we compare the output that the system has to the desired output, in this case, saying that it is a photo of a cat, and we make adjustments to the system in order to make it make fewer errors in the process. This is something that is very general, and this box diagram, although it seems very simple, is actually a good summary of how Google's machine learning systems work in general. And the reason that we do it this way is because the writing rules that describe all of the differences that can happen in the rich world just isn't possible. So this is a example that I enjoy because I think it's quite funny, is that these are close-up photographs of blueberry muffin. I have thought that these kinds of photographs would be easily confused by computer systems, but until the use of artificial intelligence and machine learning, it would be very hard for someone to write down a list of rules that allows us to tell whether a photograph is a muffin or a chihuahua. But today, machine learning systems and artificial intelligence systems are able to do this quite successfully. Now, I was actually trained not originally as a computer scientist, but as a neuroscientist, as someone who studies the brain. And so often I get questions about what is the relationship of today's artificial intelligence systems to the functioning of biological brains. And it turns out that the dominant sort of artificial intelligence today is something called deep learning, which is really a reincarnation of a technology called artificial neural networks that has been around since the 1980s or 1990s. And this technology is based very loosely on how the brain learns to see and learns to process information, are quite limited. In artificial neural networks, as well as in real biological brains, each individual neuron is connected to a small number of other neurons. Based on what that neuron sees from its compatriots, it decides what its own decision would be, and the individual elements of the biological or artificial neural network must learn to coordinate in order to accomplish the task. But beyond these three simple points of comparison, there is very little similarity. We don't think that this is really an accurate model of the biology of the brain, but it's something that allows us to do useful tasks in the world. And the way that I would explain this is that as a neuroscientist, I think that this is mostly the unconscious kind of thinking that we all do, being able to understand what someone is saying when they speak, being able to recognize our own name, being able to identify what is in an image. These are all things that we do using our minds, but without much conscious thought. One of the areas where this has made an enormous difference that is both relevant to healthcare and has also been very instructive for the underlying science is in applying it to computer vision, the ability to try to make machines that see. And in computer vision, we have things that we try to do, like categorizing images, finding things in images, or describing what is in images. But there are analogs to each of these tasks in medical imaging as well, trying to do diagnostics or find regions of interest or to summarize a case. Let me walk through an example of how we at Google have used artificial intelligence and machine learning technologies in one of these applications. And the application that I'll talk to you about is in diagnosis of diabetic retinopathy, which is a complication of diabetes that is vision threatening. We began working in this area with partners that we had in India, where there's a significant shortage of qualified doctors to be able to screen the diabetic population. Screenings are traditionally done by using an image of the back of the retina. And you can see here that even an untrained individual can see the difference between a retina that is experiencing disease and a healthy retina. And we asked with our partners, could we support their screening efforts by helping to build an AI system to help triage cases as they came in? And so what we did was we partnered with them to take 130,000 images and have them be read by 54 human ophthalmologists and give each of these images a grade in terms of what level of diabetic retinopathy was present. And then we can use that to ask the machines to learn to imitate that behavior. And in fact, ultimately, we can build computer systems that have a sensitivity and a specificity that is comparable to the ophthalmologists and retinal specialists who help train the system. And so what that means is that because these machines can imitate, they can capture some of the wisdom that these doctors have in terms of being able to recognize a disease. But in general, I view the machine learning systems that we have today as complements to human intelligence. Humans are excellent at extrapolating from a small number of examples, while machines are better at interpolating between an enormous number of examples. And when you ask machines to make inferences from a small amount of data, we often get poor results. But when we have a large amount of data, historical data that we can use, sometimes we can build machines that can operationalize those same systems moving forward. But sometimes there are surprises. Sometimes the machine can see things that humans can't see. One of the examples that came up that was a surprise and a delight for us is that we discovered in looking at these photos of the retina that actually a machine learning system could be trained to guess the patient's age or their smoking status or their systolic blood pressure. These are not clinically relevant, of course. It would be much easier to get this information directly from the patient than it would be to get it from a photograph on a retina. But it demonstrates that sometimes there are biomarkers that are present in the data that we already have that is invisible to humans. But when we think about using these in clinical practice, a number of important questions come up. One common question that we get is, how do we understand what the machine is using? There's a colloquialism that people say, it's a black box. We can't see what it's doing inside. But that's not exactly true. In fact, we believe that these digital systems can collaborate with people in much the same way that humans collaborate together. And if you have two radiologists talking about a study, they'll be pointing at the study that they're looking at and saying where in the image they see evidence for their case. And we can actually ask machine learning systems to do the same thing. So on the left here, you see the original image, which was graded by the artificial intelligence as being a moderate case of diabetic retinopathy. And then on the other panel, what you see in the highlighted green areas are the portions of the image that most drove that decision. In other words, the artificial intelligence is able to say where in the image it based its decision. And in our studies, we found that this often allows human and machine collaboration to proceed in a way that's very natural and really enhances the performance of the system overall. So this was just one example of how we've applied this technology in our research groups at Google, but I want to pause here and talk about what I think the larger implications are for healthcare as an industry, and in doing so make allusion to how the technology has been used in other contexts away from diabetic retinopathy. So what do these advances in artificial intelligence mean for healthcare? Well, one thing that I hope is obvious is that this could be used to make screening and preventative measures more scalable and more cost-effective. On the far left, that's a photo of some of our collaborators in India actually using the system that we helped to develop to screen patients for diabetic retinopathy. But we've also demonstrated that these same technologies, these same recognition technologies, can be used in programs for screening for breast cancer, in programs screening for colon cancer, in programs screening for tuberculosis, and even programs screening for prostate cancer. You say, maybe it's possible that by reducing the costs and increasing the accuracy of screening systems, we'll be able to improve improve healthcare overall. Another thing that really resonates with Google's drive to try to organize information and make information more useful is to see how these same Google technologies can be applied to healthcare IT and information systems. And so for the last several years, we've actually been working on piloting technologies that allow us to search over standardized forms of electronic medical records to be able to surface the information that is most relevant to the clinician, trying to make the technology helpful rather than simply overwhelming the clinician with more and more data. Another area that I think is really important is the process of building data-driven medicine. I believe that this is an area where these technologies are particularly useful, not just artificial intelligence, but also data science. To be able to understand at a data-driven level what typically happens in similar cases from this population. And we can use this both to triage cases, to potentially spot errors, to make early recommendations. These are all opportunities that I think are a logical consequence of how the technology has been developing. But I think the ultimate goal, and a big part of the long-term value here, is the possibility of building a learning healthcare system. And what I mean by that is that I think in the ideal case, every time we care for a patient, we should get better at caring for all future patients. And this is certainly true at the level of individual doctors who learn from their life experience, of services at hospitals that review cases and learn from them, and even from entire healthcare systems. But I believe that bringing technology to bear here can really improve how well this works. And in fact, we've already done some research to show that if we take electronic medical records from large healthcare systems and we normalize and standardize the representation of those data, machine learning systems can learn to infer things like better accuracy, the time when a patient might be being readmitted, or some of the more challenging complications that they may face. And I believe having these kinds of systems that recognize case much the same way that experienced nurses are able to do so will allow us to build systems that help everyone operate more efficiently and to the benefit of patients. But in closing, I think the thing that really resonates for me is that there are several elements that I think are going to change in healthcare over the coming decade. And I think that these things are positive, but they're going to take some time, and they're going to take collaboration between governments, healthcare providers, private companies, and individuals. Very much on the horizon is affordable, scalable, accurate, and personalized screening for common medical conditions is the kind of thing that I think artificial intelligence can help bring to a much larger set of the population. In a way, what we're thinking of is the possibility of being able to provide care multipliers, things that allow staff and clinicians to be able to reach more people and to be able to care for more people. The second thing is that I believe that this technology is going to lead to information systems that put doctors, patients, and care first. And this is something that I think that we all look forward to. Any of us who have ever worked in hospital systems have seen that sometimes information systems are a challenge, and making those systems more responsive to the needs of users is something that we simply must do. But in order for these things to be possible, it all starts with trust. We have to build trust in the technologies, and we have to build trust in how they will be used to benefit people. And I think that the end objective for this industry should be to make artificial intelligence in healthcare as trustworthy as your car's anti-lock brake system, where we can all believe it is helping us be safer and helping us work together in a way that's a delight to be able to see you, and I look forward to answering some questions.
Obrigado, Greg. Excelente apresentação. Muitas perguntas já chegaram e muitas já foram provocadas aqui, né? E eu vou começar trazendo uma perspectiva pela lógica da eficiência. Ontem, 2 dias atrás, eu tenho uma meia que eu queria comprar uma igual, mas a única coisa que eu tinha da meia, eu não lembro onde eu comprei. Não lembro, em alguma viagem eu comprei. A única coisa que eu tinha da meia era a logo dela, era uma letra ômega, né? E aí eu peguei o Google Lens, né? Tirei uma foto da meia, né? E descobri qual era a marca, onde vendia, e a meia está chegando, né? Eu estou usando esse exemplo porque eu desafiei, né, a tecnologia, né, a inteligência artificial, uma coisa de baixo risco e simples, mas é um entregável, né? que tangibiliza a potência da tecnologia. Quando a gente vai para a medicina, a gente é muito arrogante, a gente quer que a inteligência artificial faça diagnóstico de câncer raro, né? Já na sua primeira versão, né? E talvez isso eu tenho certeza que para quem trabalha em pesquisa, né, é um desafio excitante. Mas para quem tem o compromisso de montar um sistema de saúde sustentável, talvez seja um desafio cuja entrega vai acontecer daqui a muito tempo, como são os self-drive cars. Eles vão demorar mais, porque são missões críticas, né? Então, a pergunta que eu te faço, será que não tem alguma coisa na utilização da inteligência artificial, ou até te perguntando se você concorda com o termo inteligência aumentada, né? Eu acho que o que você falou me lembra muito esse conceito da inteligência aumentada, ampliada, né? Será que, no caso da inteligência artificial na área de saúde, a gente não está pedindo para uma criança aprender integral e derivada, né, aos 2 anos de idade, quando tem muita coisa simples, né? Para os radiologistas, o diagnóstico mais comum em radiologia é normal, é o diagnóstico de que é normal, né? O diagnóstico normal é o anticlímax do radiologista, ele está lá para procurar, obviamente, alguma doença, né, que o diagnóstico dele permita tratar e curar, né? Então, o normal é uma distração e consome mais de 80% dos recursos. É mais fácil eu treinar um algoritmo para dizer o que é normal do que treinar para dizer o que é doente, né? Então, se eu tirar da frente tudo que é normal, né, e usar alguma metodologia de crítica, né, para saber se aquilo está correto, né, eu provavelmente vou permitir que aquele trabalho sofisticado, né, que os médicos mais bem treinados podem fazer, possa ser feito por um número maior de pacientes. Então, eu queria trazer essa perspectiva. Você não acha que tem alguma coisa que podia ser se você conversa com o pessoal da medicina, eles vão querer te desafiar. Eu quero ver se você é capaz de fazer diagnóstico de câncer raro. Eu quero ver se você é capaz de fazer diagnóstico de raio-x normal, raio-x de tórax normal, bem simples, ou uma tomografia normal.
Yeah, I believe the way that you've just described this, Charles, is exactly the way that I see the situation that we find ourselves in. I believe that augmented intelligence is exactly are the pieces of work in the workflow that are very common and are very uninteresting in some ways. And this goes to the point about extrapolation, which humans are better at, about taking a small amount of information and being able to draw a conclusion from it, versus these common cases. And to your point, what we've done in tuberculosis screening is actually exactly what you suggest. Because there are so many faces of how tuberculosis can present in a chest x-ray. The most expedient things that can quickly triage irregular or abnormal as compared to something that is perfectly normal. And by doing this, we allow clinicians to focus on the cases that are more difficult, to focus on the cases where it's not obvious, where it depends on the interaction with the patient. And it's an opportunity to let us be more human with each other, to practice medicine.
Perfeito. Fico muito feliz de saber que a gente tem uma empresa, uma organização como o Google alinhando, né, esse foco, né, para trazer entregas mais rápidas e que podem contribuir melhorando a eficiência. A gente sabe que esse é um grande desafio dos sistemas de saúde, a sustentabilidade dele, né? A gente precisa tornar ele mais acessível, né? Ele tem que ampliar o acesso. Acho que esse é um grande desafio de todos os sistemas de saúde e acontece também, né, aqui no Brasil. Como é que tem muitas perguntas chegando aqui? Vou trazer uma. Os registros de saúde individual, né? Eles foram tentados por várias empresas, né? E até hoje a gente não conseguiu chegar a um padrão ouro, né, de registro de saúde individual, né? Por diversas razões. Qual é a sua visão em relação a isso? O que você colocou para o Google, por exemplo, como obstáculo para a materialização dessa visão de empoderamento, né, do paciente, de que ele detenha seus dados, né? Qual foi a discussão aí? A gente quer saber tudo o que acontece aí nos bastidores.
So a very big part of being able to make information useful is to be able to have standards and opportunities to exchange information in a way that's more open. And I think that that's part of the reason why we've seen that it's critically important for to work with providers of electronic medical records and works, and to understand how are able to work with the data that they have in their systems in a way that is natural and in a way that is transparent. I think that one of the great challenges that we face today is that there is so much data in these systems, but it is very difficult to interpret. You almost have to have been there in the moment in order to understand sometimes what things mean. The good news here is that we've seen that machine learning systems are very good in the fullness of time of coming to understand natural language, to understand all of the varieties in which the variety of ways in which humans communicate, whether that's multiple languages or different accents or different ways of expressing the same idea. And we've found that we have some success in being able to learn from what happens in one healthcare system and to be able to generalize that to another healthcare system. I do think that this is something that is a very long road in order to be able to develop and is actually going to require multiple years and iterations in terms of how we make data available while maintaining all of the privacy and security elements that are so important in healthcare.
Obrigado, Greg. E aí, nessa linha, né, se você tivesse que categorizar as soluções de saúde do Google, você as vê mais voltadas para empresas ou mais voltadas para profissionais de saúde, para os indivíduos? Como é que como é que vocês estão se posicionando em relação a essa segmentação?
Yes, it's a great question, and I believe as a technologist that the answer is both. That if we want to enable billions of people to be healthier, we have to work towards that vision by meeting people in their everyday lives, and as well as partnering with their caregivers and medical professionals to provide accurate, accessible care. So I think that the technology can work both with the clinician, and in some cases, it can work directly with people who are trying to provide care for their families, for their children, community healthcare workers. I think that the entire spectrum, there's possibility. And in fact, at Google, we both work with hospital systems, and we also try to develop technologies that are helpful to people in navigating their own healthcare journeys as a patient or as a member of the family.
Greg, e a pandemia, né? Essa pandemia, ela evidenciou muito claramente o papel da ciência e da tecnologia em saúde como decisivos para o enfrentamento, né? Talvez parte da razão pela qual a pandemia se espalhou tão rápido também se deva a isso. Mas, né, o remédio também veio por aí, né? Como é que você avalia esse momento que a gente viveu no mundo e quais foram assim, as lições aprendidas, né, pelo Google nesse processo? O que a pandemia trouxe de aprendizado e o que você acha que fica como legado?
Yeah, it's been an unprecedented time in history, obviously, for healthcare. It's put a tremendous strain on the global healthcare system. And I think from a Google perspective, we've seen that access to the right information at the right time can save lives. And part of the role I think of an organization like Google can be is to help connect people to information that's helpful. So many people come to Google for information, and it's critical that we provide information that is trustworthy and authoritative. And I think that there's clearly room for us to do better, to serve the populations better in presenting information that is accurate and balanced in order for folks to be able to make good decisions, both at the level of individuals and at the level of population health and public health decision makers. I also think that one of the things that we've seen is that there's an opportunity for technology companies like Google to help existing health research using the data and technologies that we have available. And so we worked closely with folks to develop community mobility reports, which was a privacy preserving mechanism that was available internationally for healthcare departments and individuals to see the impact of various mandates and travel restrictions. We also provided data about symptom search to help everyone understand what are the questions that are present in the population about COVID. And also we've released tools on vaccine insights to try to help organizations that are trying to distribute vaccines to understand, well, how are there areas where there are underserved populations that need to be reached? And we've really seen, I think, a great opportunity come into focus through this crisis, where private companies can help in making good, in helping public health officials make good decisions, while still leaving all of the authority for that decision making with the right parties.
Eu vou ter a oportunidade de agradecer, né, ao Google em seu nome, porque a gente usou muitas ferramentas, muitas informações disponibilizadas pelo Google para avaliar o grau de mobilidade, né, por região, e todas elas estavam disponíveis, e eu acho muito interessante, né, que a gente tenha essas ferramentas colaborativas, porque eu acho que a pandemia mostrou que não tem saída sem a colaboração, né? A gente pode ter concorrência, mas na saúde não dá para ter competição. Competição se pressupõe sempre que alguém perde para alguém ganhar. Concorrência pressupõe que a gente coloca a barra mais alta e alguém vem e coloca a barra mais alta ainda, e aí a gente está, de fato, contribuindo para melhorar a condição de vida das pessoas, né? Então, aqui eu estou de público aqui agradecendo, porque acho que vocês prestaram um serviço relevante para a humanidade nesse sentido. Aí eu tenho uma pergunta aqui que me vem, né, quando a gente fala de saúde, né, a gente precisa incluir a dimensão do comportamento humano, né? Se a gente fosse imaginar que as pessoas parariam de fumar só porque o médico disse você precisa parar de fumar, estava tudo resolvido. A questão já foi informação. A gente sabe que mudança de comportamento é uma combinação de informação com motivação, né? A informação está resolvida, né? Vocês já resolveram esse problema para a gente. Agora, a motivação é outro bicho, é outra complexidade. Como é que vocês estão trabalhando essas variáveis? E tem muita coisa, né? As pessoas dizem o que as motiva, né? Hoje, se eu postar que eu tenho hoje um bebê de 6 meses, né, que nasceu agora, que eu fui pai recente, você provavelmente vai saber como me motivar a cuidar da minha pressão ou perder peso, né? Como é que vocês estão trabalhando essa dimensão da motivação, né, combinada com a informação para promover mudança de hábito? Se você puder contar.
I think that the area in which technology is most useful here is in making the behaviors that we choose as people, as individuals, making it easier for us to stick to our decisions, to stick to the things that we've decided ourselves or with our families or with our doctors, and give us the tools that allow us to do that more easily. And let me give you an example from my own life. My mother had often been very disappointed that I didn't send a card for her birthday. And this was because I would forget until it was too late. And simple pieces of technology, like just being able to put on my Google Calendar 2 weeks in advance, send a card to your mother, is exactly the kind of thing that I think that these technologies will do on a much grander scale. Is that I think the technologies will allow people it will be helpful in making the decisions that we make stick. But ultimately, I think it must reside with the individual, with the family, with the care team, in order to decide what is right for you, and what is the strategy that you want to make in the decisions that you want to take in your life, to trade off all of the risks and benefits in the world. But if we can make it easier for people to have the information to make the decision that they want to make, and then make it easier to execute on that decision faithfully.
Muito bom. Tem mais uma pergunta aqui, que é a preocupação sobre o autodiagnóstico, né? Vocês têm algum receio que o autodiagnóstico possa, de alguma maneira, induzir tomada de decisão errada, enfim, pode ser prejudicial de alguma forma?
Yes, absolutely. So everyone here knows how complicated healthcare is, but really these things are just tools that we want to make available to allow people to make better care decisions. I recognize that I think it's complicated, but trying to build the tools in such a way that it is obvious how to use them correctly, and to give guidance to people on how to use them well, is really an important part of what we want to do. But our journey in health has been a learning about what roles technology can and cannot play. So, for example, we've seen that it behaves very well in assisting the reading of mammograms, but the way that we use it is in complement with trying to offer things to consumers. We have to be very clear that we are not offering something that is a replacement for care with your doctor. Health is much more holistic than these systems will really be able to wrap their head around. They're just tools to help you get started. But I really believe that the direction that we want to move in is one where we're providing tools that help patients understand, is this something that I need to seek care for? And where the information they're getting is the information that their own doctor would recommend to them. And just to kind of be an extension of that, that community that's giving care. And that may mean that the answer isn't actually the same for every individual. It's actually part of trying to make the system work for as many people as possible without necessarily treating everyone the same.
Greg, estamos chegando perto aqui do final do nosso painel. Visão do Google Health, para as soluções de saúde, de futuro, né, com esse mesmo arrojo, com essa mesma visão grande que o Google tem. O que vocês estão desenhando para o futuro assim, no Google Health?
Yeah, so I believe that it's going to take many years, but I believe that in the future, we'll be able to move in a direction where the technology is more pervasively useful and where it is trusted. And I think that the way that we start is by working together with care teams, with hospital systems, to identify what are the problems that you think AI can solve, to communicate an understanding of what the technology does and what it doesn't do, so that we can get input from the community about where the technology should be best used and where is opportunity of having a learning healthcare system, something that scales better to large populations at low cost, and where we're able to catch the most debilitating and common conditions early and really get into a mode of global preventative medicine. I think that this is possible, but it will require governments and hospital systems and private corporations to work together in order to achieve that future.
A gente escuta muito, você certamente conhece os futuristas que dizem que a cada ano de vida a gente ganha, hoje a gente está ganhando, agora com a pandemia isso mudou um pouco, mas a gente está ganhando 0,15 ano de vida se você vive mais um ano. Na medida que a tecnologia avança, daqui a pouco a gente não morre mais, vamos virar imortais. Então, estão prometendo a imortalidade, mas ninguém prometeu a invulnerabilidade. Então, a gente vai precisar muito dos recursos, né, de tecnologia, porque essa imortalidade virá às custas de muito cuidado, né, de muita atenção com a saúde. Esse vai ser o trade-off, né, da imortalidade tão sonhada. E a gente conta muito com o Google para isso, e eu não posso deixar de vender o peixe do Brasil para o Google e dizer que a gente tem um sistema de saúde muito diverso, né? Não necessariamente por boas notícias, né? A nossa desigualdade aqui, ela impõe a realidade de que a gente tem um pouco de cada continente no mesmo país. Então, assim, acho que é uma diversidade muito interessante para o desenvolvimento disso, de tecnologias, e pode contar por intermédio da ANAP, né, com a nossa colaboração para o desenvolvimento de soluções que tornem o sistema de saúde, de fato, sustentável, né, acessível e com desfechos clínicos de qualidade, focado no cuidado, né, focado na prevenção, né, que eu tenho certeza que é a ideologia e a visão que o Google tem também para a saúde. Então, eu deixo aqui para uma palavra final sua, já te agradecendo muito pela palestra, pela conversa brilhante, gostosa, e ano que vem a gente volta para o presencial. Eu tenho certeza que se você puder vir para estar aqui pertinho com a gente, vai ser um privilégio.
that would be absolutely wonderful. I look forward to that opportunity. I do think that one of the things that I really value about the opportunity of bringing artificial intelligence to healthcare is reducing health disparities. I think that is actually the biggest opportunity here, is to be able to bring a little bit of the care that is available to the most fortunate of us and really replicate that and distribute it in a way where it's accessible to everyone. I think that that is the most likely role for artificial intelligence, is scaling this care. Thankfully, I don't think that it will be useful in creating immortality. I don't think it will work, and I think that's good. Thank you so much. It's been a pleasure to talk to you all, and I look forward to seeing the great work that everyone in the community does going forward as we face these challenges together.
Obrigado, Greg. Foi grande prazer. Bom, pessoal, estamos chegando perto do final. Eu devolvo aí a palavra para a Isabela. E grande abraço, Greg. Obrigado.
Thank you, Charles.